My name is Sarah. I'm recently married and I discovered that my husband has a sexually transmitted disease and I'm really worried that I get infected too. So please tell me, what shall I do?
Hello Sarah, don't worry, there are many ways to protect you from getting sexually transmitted infections. But first let me tell you all about it. Sexually transmitted infections, STIs, are infections or diseases that are passed on during unprotected sex with an infected partner. These diseases are transmitted by sexual contact, skin-to-skin contact, blood transfusion and sharing needles, mother-to-child during pregnancy or at time of delivery. Do you know how many STIs are acquired every day? More than 1 million sexually transmitted infections are acquired every day worldwide. Types of microorganisms causing sexually transmitted infections include bacteria, parasite, virus, and mites. The most common types of sexually transmitted infections in Saudi Arabia are pneumococcal urethritis, trichomoniasis, gonococcal urethritis, syphilis, AIDS, and others like genital warts, genital herpes, chancroid are not very common. If you suffer from unusual discharge from your vagina or penis, difficulty or pain when you urinate and during sexual activity, any skin changes on and around the genital region, like blisters, lumps, bumps, warts, sores, rash, cracked skin, or itching and irritation, you should consult a doctor. Pneumococcal urethritis is the most common cause of sexually transmitted diseases, which infects women more than men. In men, causes inflammation of urethra, discharge from penis, pain in scrotum, while in women causes inflammation of the cervix, and bleeding between two periods, and in both genders lower abdominal pain is present. Newborn may get infected too. He will develop pneumonia, which is the inflammation of lungs, or eye inflammation. If left untreated, it can lead to other STIs, or arthritis, which is an inflammation of joints, or prostate gland infection. Trichomoniasis, well, this disease is caused by a protozoan, which is a type of parasite called Trichomonas vaginalis. The most common symptoms are, in men, itching or irritation of penis, burning after urination or ejaculation. In women, a foul-smelling vaginal discharge with a yellow, green or gray color. Genital redness, burning and itching. If left untreated, it can lead to other STIs, and prostate cancer. Gonococcal urethritis is the second bacterial disease, caused by gram-negative bacteria called Neisseria gonorrhea. This sneaky bacteria usually causes inflammation of the genital systems in either men or women. And didn't stop here, but sneaked until infecting the baby in the womb of the mother, causing a serious eye problem called ophthalmia neonatorum, which is an inflammation of eye, and may lead to blindness. After that, comes the syphilis. Syphilis is also caused by a bacteria called Treponema pallidum. Alarming signs could be a skin rash, sore in mouth, vagina or anus, fever, swollen glands, weight loss, hair loss, headache, extreme tiredness, or muscle aches, and if a pregnant woman is infected, the baby may have a characteristic teeth shape, and a skin rash copper color. Complications can be lumps or even tumors, brain problems, heart diseases, AIDS, pregnancy and childbirth problems. Acquired immunodeficiency diseases, AIDS. This is a virus type caused by human immunodeficiency virus, HIV. At the beginning of the disease, the infected person will not show any alarming symptoms, but after 1 or 2 months, he may only have flu-like symptoms as fever, headache, tiredness and enlarged lymph nodes, which eventually disappear after 1 week to a month. But after 10 years or more of being infected, he will have rapid weight loss, tiredness, frequently getting fever and sweating at night. Fortunately, there's a home HIV test, in which if it turned to be positive, you should consult a doctor for further tests and investigations. In a nutshell, the common complications of all STIs are infertility in both women and men, pregnancy outside the uterus, delivery of a premature baby, pelvic inflammatory disease, which is an infection of female genital system, eye inflammation that could lead to blindness, heart diseases, and also may lead to various cancers, such as cervical cancer, anal cancer, and liver cancer. What could you do to protect yourself from STIs? First, make sure you practice safe sex, by which you use condom regularly and correctly during every sexual encounter. Avoid having multiple sexual partners. And avoid homosexuality. Regular checkup and tests are so important. Abstain sex if possible, and male circumcision is a great opportunity to decrease the risk of getting infected. For further information, please consult a doctor. Stay safe.
العدوى المقبولة جنسيا هي العدوى التي تنتقل عبر علاقة حميمة غير آمنة مع شخص معدي في الأساس. يشهد كل يوم حدوث مليون حالة جديدة من أنواع العدوى المقبولة جنسيا. انتقال العدوى تنتقل بين البشر من خلال الاتصال الجنسي، وبإمكان العديد منها ولا سيما فيروس الإيدز والسهري الانتقال أيضا من الأم إلى طفلها خلال فترة الحمل وأثناء الولادة، وكذلك من خلال عملية نقل منتجات الدم أو عن طريق ملامسة البشرة. هناك أكثر من 30 نوعا من البكتيريا والفيروسات والطفيليات المختلفة التي يمكنها الانتقال جنسيا بين البشر، وأهمها أنواع العدوى البكتيرية الشائعة المتدثرة الحثرية تسبب داء المتدثرات، النيسيرية البنية تسبب داء السيلان أو المكورات البنية، اللولبية الشاحبة تسبب الزهري، أنواع العدوى الطفيلية الشائعة المشعرة المهبلية تسبب داء المشعرات المهبلي، أنواع العدوى الفيروسية الشائعة فيروس العوز المناعي البشري يسبب الإيدز. أهم الأعراض: تسبب العدوى المنقولة جنسيا إفرازات غير مرغوبة وصعوبة في التبول ونزيف ما بين الدورة الشهرية، وأيضا تؤدي إلى التهابات الجلد، الحبوب أو التقرحات، مما يؤدي إلى الحكة. المضاعفات: تخلف أنواع العدوى المنقولة جنسيا والتي تظل بدون علاج آثار وخيمة على الصحة الإنجابية مثل الحمل خارج الرحم، وربما تؤدي إلى الإجهاض أو الولادة المبكرة. وكما تمثل تلك الأنواع من العدوى أهم أسباب العقم، وبخاصة لدى النساء، وبعضها قد يؤدي إلى سرطان الرحم أو الشرج أو الكبد. الوقاية: إن أنجح طريقة لتجنب اكتساب أحد أنواع العدوى المنقولة جنسيا أو تجنب نقلها هي الامتناع عن ممارسة الاتصال الجنسي أو الاختصار منه ضمن علاقة طويلة الأمد مع قرين لا يحمل أي نوع من أنواع العدوى المذكورة. وتضمن الوقايات الذكرية عندما تستخدم بطريقة سليمة فعالية عالية في الحد من انتقال العدوى. وأيضا لا ننسى أهمية تطهير الذكور. ولأي استفسارات أخرى يرجى مراجعة أحد الأطباء المختصين. الدين الإسلامي دين طهارة ودين عفة، ولو أننا التزمنا بتعاليمه لما انتشرت مثل هذه الأمراض، كما قال تعالى:
ولا تقربوا الزنا إنه كان فاحشة وساء سبيلا.